Assalamu alaikum. I'm Dr. Anika Tasneem Chowdhury. I'm working as a study physician with the Maternal and Childhood Division of icddr. My abstract title is Birth Preparedness and Complication Readiness among pregnant women of the hazard-prone areas of southern Bangladesh. It was a cross-sectional study. According to the Bangladesh National Strategy for Maternal Health, we have to achieve a rate of institutional delivery to 85% by 2030 if we are to achieve the SDG of reducing maternal mortality ratio below 70 per 1 lakh live births. However, we are still standing at 65% according to the recent BDHS that was conducted in 2022. According to WHO, birth preparedness and complication readiness is a recommended health promotion intervention which can help us to elevate this rate and reach our goal. According to the literature, BPCR coverage of 4 components in hard-to-reach areas was found 25%. However, BPCR coverage of all 5 components in rural areas was found only 6%. But there is a positive data about the BPCR coverage in hazard-prone areas of the southern Bangladesh. We all know that the service utilization, especially the maternal health service utilization, is lower in the southern part of Bangladesh compared to the rest of the country. So the objective of our study was to understand the birth preparedness and complication readiness status of pregnant women in the hazard-prone areas of southern Bangladesh, and to understand the association of BPCR with institutional delivery, selection of institutional delivery in those areas. We collected BPCR-related data from a cluster trial, from the baseline survey of a cluster trial. It was conducted on 15 to 49 years old pregnant women who were in their 28 to 36 weeks of pregnancy and were registered in the FWA register. We invited all the pregnant women who met our inclusion criteria from the FWA register, and 572 pregnant women responded and consented to take part in the study. The respondents were from Bhola Shodor, Lalmohon and Chorfashan sub-districts of Bhola district, and Chatpur Shodor, Kochua and Faridganj sub-districts of Chatpur district. The baseline data was collected from 1st June 2022 to 30 June 2022. We used structured questionnaire to interview our respondents, and we estimated the proportion of the categorical variables and performed multivariate logistic regression to find the association. Here is the background characteristics of the respondents. Majority of the respondents were in the age group of 21 to 25 years, had a secondary level of education, mostly were unemployed, and their monthly family income were between 8,000 to 12,000 BDT. Among the respondents, here we can see that half of the respondents perceived that institutional delivery is only necessary if complication arises. And here we can see the birth preparedness and complication readiness status among the respondents. Only 7% of the respondents reported that they have planned all 5 components of BPCR. 75% decided their place of delivery. 55% identified a skilled birth attendant. 40% arranged transport. 28% saved money. And only 16% had blood donors ready. Now, here we can see that the proportion of having all 5 BPCR components in relation to ANC. We know that BPCR should be planned from the very first contact of antenatal care. But here we can see that only 13% of the women who received at least 4 ANC were prepared with all the 5 components of BPCR. And women who had no antenatal care or had no contact with any healthcare facility had no idea of any BPCR. This is the graph showing factors associated with the selection of institutional delivery. We can see that families' monthly income, number of children, at least 4 ANC, respondents' knowledge about danger signs, and counseling on institutional delivery, perception of the respondent on institutional delivery, and BPCR are the factors associated with selection of institutional delivery, where we can see that the likelihood of selecting a healthcare facility to deliver their child was six times more among the women who had planned all their 5 components of BPCR compared to others. So coverage of all 5 components of BPCR is very poor among the pregnant women of hazard-prone areas of southern Bangladesh. Policymakers, facility managers, and healthcare providers should emphasize the achievement of improved coverage of all the components of BPCR to increase institutional deliveries and combat birth-related complications proefficiently in the hazard-prone areas of southern Bangladesh. Thank you.